This is the case of a 43-year-old African American male with past medical history of alcohol-induced liver cirrhosis, hepatitis B, GERD, and chronic pain on opiates, who presents to the emergency department with complaints of chest pain and right upper quadrant pain that radiates to his back and right shoulder for the past month. He describes the pain as constant and dull, and sometimes even sharp after eating. He states he has taken Tylenol and ibuprofen with no relief of pain. Eating sometimes does exacerbate the pain, but usually goes away after about an hour after eating. On a pain scale of 1 to 10, patient states that his pain is at an 8. CT abdomen done in the ER shows that there is a duodenal wall and pelvic wall thickening and stranding. This is also seen adjacent to the gallbladder. Ultrasound of the right upper quadrant does show gallbladder has moderate dependent sludge and posterior showing gallstones. Gallbladder wall thickening up to 4 millimeter is noted. Trace amount of pericholecystic fluid is suggested. Patient was admitted to the hospital for acute cholecystitis. Review of systems, patient states that he does have some nausea and right upper quadrant pain that radiates to his back and right shoulder. Physical exam shows tenderness in the right upper quadrant upon palpation. No other findings on the physical exam. Patient's vital signs show heart rate of 81, blood pressure is 132/74, respiratory rate is 18, and his oxygen saturation is 98% on room air. Blood work also done in the ED reveals slightly elevated white blood cell count at 14. Treatment plan for this patient is IV broad spectrum antibiotics. So patient was started on IV Zosyn in the emergency department, and surgery consultation done at that time. Surgeons did see him in the ER and stated that he was to be added to the schedule for robotic cholecystectomy done on the same day. Patient was made NPO, was given IV fluids and analgesics for his pain medication. Due to his chronic opioid use, we consulted pain management to oversee his pain medication regimen while in the hospital. Health promotion for this patient includes seeing a primary care annually, which he states he does not usually see a doctor outpatient, as well as getting a flu shot annually. I would also recommend that this patient see a gastroenterologist for liver cirrhosis and the hepatitis B as well.